I don't want to do that because I don't want them to know I'm black. So at the moment my basic pay is 93,700.
Do you think accent is part because you speak like you're British?
Oh, that's another story, Nanelle. I want to make it a lot more easier for people that look like us to get to where they've got to. I think the reason why I speak the way I speak is, when I reflect now, was because of racism.
Said it before. Hey, stop that.
Hi, Nanelle.
Let me just say, I am so privileged to have you. I am so privileged. You have no idea. If you don't know me, my name is Nanelle. Today I have here someone extremely special. She's band 9. She's the band 9ers in the UK, guys. She's band 9. Good. She's going to tell us all about Band 9, how she got there, any tips for people that want to get there, how much Band 9s earn, and all that. If you're interested, just stay tuned. Hi, Sab. Is it Sabrina?
Sabrina, but my friends call me Sab, so yeah.
Okay. And guys, she has a YouTube channel. I'll leave the link in the description, and I'll leave a screenshot of the page in the video so you can go and then check. Tell us a bit about yourself and how you got to Band 9.
All right, cool. So, hi everybody. As Nanelle says, my name is Sabrina Phillips. I'm also born and bred in St. Vincent and the Grenadines, which is a small island in the Caribbean. And I moved to the UK in 2001. So I've lived here more than half of my life. So when I came over in 2001, it was about summer. So I came and I joined my aunt here. My aunt is amazing. She was a midwife, health visitor, and plus still find the time to do a law degree in her spare time. But she was the person that helped me to get into nursing. So I came in summer and I started my training in September.
How old were you then?
Yeah, I was 19.
Okay.
I did my training here in the UK. So I did a 3-year course, and at the time it was diploma in nursing. There was the option of doing the BSc or a degree course, but I did a diploma. I remember when I trained in Buckinghamshire University, Chilterns College, which is now Bucks University, for those of you that might know the uni, and it's sort of in the sticks, and when I back end of London. I remember in my second year, because it was a 3-year course that I did, I was looking for jobs, and I remember seeing a 2-year rotation program at the time at South London and Maudsley Trust, and I thought, that is the job I am going to do. So come the 3rd year, it was the only job I applied for, and I managed to get it. But a funny story is, I remember going for the interview, and I remember I said I trained in Bucks. I lived in Hammersmith, but I didn't know London that well, and I got lost trying to get to the interview. So I remember coming out of Waterloo Station for the first time and trying to get to King's College, which now I know is across the road, but I kept walking towards Elephant and Castle, which is what so I kept doing that, and I had to ring them to say I was lost.
Aww.
I remember getting in a black cab and giving the man the address, and he's like, it's just over there, and I was like, no, please take me there because I will get lost.
It happens. It really does happen.
Yeah.
You got that job, and then you did it for how long?
So it was a 2-year rotation, and what was really good about it is that part of the 2 years I was able to do my top-up degree, so the hospital paid for my top-up degree, and also it was 3 placements. It was almost similar to doing your nurse training, where you're going from placement to placement, but I was a qualified nurse. So I did 3 specialist roles. I worked in children and adolescent first, which I'd never done as part of my training, and I absolutely loved it. Then I went into what at the time was peripatetic rehabilitation, which essentially means rehab in people's home in Lambeth. And then my final placement was on a female acute ward at the Maudsley. An interesting story. So I remember going to the ward and I was really scared, and I thought, I'm going to do my 8 months and I'm never going to go back there. I'll tell you a funny story about that. So I did that for the 2 years and did my top-up degree. And then at the end of it, I had a choice to apply for a job because I absolutely loved CAMS. I went back to CAMS and did a year there. And it was quite clear to me. So I'd been a qualified nurse for about 3 years and I wanted to go up the ladder. So at the time, we started off in the old Whitley system, which was D&E grade, for those of you that remember that long ago. When I started, I had a plan, a 5-year plan to get to H or I grade within 5 years. But then they moved over to the Agenda for Change system, which meant like some of the bandings got put together. So by then we're into the bandings. So band 5 was essentially a D and an E grade back then. And I was thinking I'd like to get a band 6 role. But I sort of knew that it wasn't going to be possible getting a band 6 role where I was in CAMS. So I looked back to where I was before, and there was, lo and behold, a band 6 role that came up on that female acute ward that I swear I was not going to go back to. So I then applied for that role and, luckily got it. And then
how long?
That was about 2007, 2008, when I got that band 6 role. And within about 3 or 6 months of being in that role, a role in the ward came up, which was the practice development nurse / deputy ward manager post. And I just thought, I really love quality improvement and supporting staff to improve. So like that job really sang to me. So I applied for it. And I got it. And, I think one of the things I've done is I've seen where the opportunities have come. And I've not thought, I don't have 20 years of experience. I've gone, well, it's something I know I can do. I've done some teaching as part of my rotation. I had my degree, I had my mentorship. So I was already, mentoring students and showing them the ropes in terms of practice. Got a deputy team leader role, I think that was like 2008 by then. Whilst I was there, I remember like my team leader at the time, she went on maternity leave, so I had to cover her role for a little bit. And whilst doing that, I remember going to a nursing event where we were trying to attract nurses to apply for roles. And the service lead at the time sort of said to me, I remember saying, have you ever thought of doing a team leader post? And in my head, like, I just thought, a team leader post, that's like a rock and a hard place. It's like so much different pressures. And I didn't really think I wanted to be a team leader. I knew I wanted to support and develop staff, and I didn't see that in my trajectory. And then she just went off, she's like, just have a think about it. And I was just there thinking, if somebody's asked me to think about something, I might as well. When she came back, I was like, yeah, I'll have a go. And she's like, that's great, because there's this role coming up in this place and I've put your name forward. So I then applied. At the time it was a secondment for a year. So I went to this ward that had at the time they'd had the Care Quality Commission in, so they had like an action plan in terms of going from not so good place to a better place. They had at the time really long lengths of stay, so where people stayed on the ward for long times, really high complaint rates, and different staff changes, etc. So it wasn't like I was inheriting it was a good place to learn. So I went there and met some amazing people, and that's where my first love of quality improvement kicked in, because at the time we were doing productive wards, so I was able to support the ward in doing that. I set up a complaint surgery, so I worked with the team to deal with complaints when service users came to them to say, how can I help them to reduce, complaints going into formal and having to, write a response when we could act on it. We had regular community meetings with service users to let them know what we were doing. And also the other thing that we did is I worked really closely with the consultant psychiatrist, just thinking about, where people were going on, if they had hours leave or 2 hours leave per day, instead of, having protracted periods of leave, can we think about them going home and discharging in a safer, quicker way? So we went from a ward that had the highest complaints in the trust at the time, plus also long lengths of stay, to reducing that quite significantly. So I was really proud of that, but also had a team that was on board and stuff. Come the end of that, because in the NHS what you learn is there's always change, so there was a restructuring and that role was given to somebody who already was a band 7, so were placed there. So I had to go back to my practice development nurse post, which I didn't really want to go back, because I thought I'd be going up, but sometimes you just have to. But the positive thing was because I'd, done the quality improvement stuff on the ward. There was a quality improvement facilitator role at Band 7 that came up. And although it wasn't substantive, because at the time quality improvement, or QI, was funded yearly. So I took a leap of faith, because even though I was working with the trust, I took what you call, it's like a short-term contract, but it meant that if the role disappeared, they'll have to redeploy me somewhere in the trust. So I took that leap of faith and applied for the role and got it. And I think it's one of the best things I ever did, because what that then allowed me to do was work across the trust, which is made up of 4 boroughs, exposed me to different meetings I'd never been in. And at the time, the trust was looking at developing their quality improvement model. Yeah, they were doing productive wards, but there's other models out there. So they asked our team to lead on what we call lean training. So lean's from Japan, where you look at your processes, make it more slicker so you have more time to care from a nursing perspective. So I was asked to facilitate the quality improvement project for a community team and the ward I used to work on. So I had already those relationships there.
So that was when you got to Band 7.
I was at Band 7, yes.
And that was how many years of
so I qualified in 2004, so that was 2010, 2011. Yes, about 6 years. And then with the QI project, I was able to lead the 2 teams, which then the trust then took it up to develop their what was called the adult mental health model, then helped me to get my other Band 8A role, which was an education and training role for what was a pathway that was like the back end of the work that I'd done in the community teams. I did the QI role for about 2 years, and then I got the Band 8A in, I think it was, I remember, May 2014-ish.
So you were Band 7 for quite a while.
For a little while, yeah. But it was one of those roles. It was so enjoyable because, I got to go around to teams and work with them to develop new processes. You can make that role what you want. I could work from different trust areas. My manager was amazing, really supportive. As part of the QI work I did, I managed to get training in Prince 2, which is a highly sought after project management course, as well as being a green belt in lean. So all that was really good for my CV, really. And then I went to 8A in 2014, and I did
there's
that.
Band 8 and there's Band 8A.
Yeah, so you got in Band 8, there's about 4 different levels. So you got, and it goes, so it's Band 8A is at the bottom, then 8B, 8C, 8D. And then Band 9. You don't necessarily have to go through each A, but people normally. So I did the 8A for a little bit, and then actually a colleague sort of said to me there was this role coming up as head of service development for another pathway rehab. I just thought, why not apply for it? And that was really good because it was a substantive role, 8B, that I got. And I went and I did that role it was really short because, again, remember I said change in the NHS, there was another restructure and that role got deleted. But then there was another opportunity to do a head of pathways role at the same 8B level. So I went and did that in a borough in Croydon. And again, I worked with community teams, specialist, what we call increasing access to psychological therapies team, or IAPT, that people might know about, and a specialist personality disorder team, which was, really is an amazing experience being head of pathway. And I got to work with service user groups, work with clinical commissioning groups. So this is like external groups to your normal teams that you work with. That had to report in on how well or not so well our teams were doing and answer those difficult questions. But it was really good learning for me.
There are people that have been Band 5 for 10 years or Band 6 so long, but your case was really different. What do you think? Is it that's your personality? You always want to push ahead, or like, what is it?
I think part of it is my personality and mindset. I was speaking to my partner about this, and he sort of said I'm quite single-minded and I know what I want and I go for it. I think also being an immigrant has helped me as well, I think, because I've come with no preconceptions of what I can or can't do, because in the country I come from, people look like me, they're in high positions. You know what I mean? So I think that's helped me to just go for the opportunities where I've got it. And even when I haven't
Not
got
the
it,
other way around. Like,
which way?
I
Go
think
on.
that when you're an immigrant and then you come, like because of the rumors that, let's say, due to your skin color or whatever, probably if you apply for a higher post, you're going to be denied, and then a local person is has better chances of getting a promotion than you, let's say, a black person or an immigrant. So there's that notion there already.
I get it. It depends. I can only speak from my own
Yeah.
perspective, because I've had conversation with colleagues who have been born in this country and have experiences where they've been told to go back home, and they're like, go back home where?
Yeah.
Peckham. You know what I mean? So I haven't come with that baggage in terms of sort of feeling like I don't belong. Being
Yeah.
in the system, I do hear the stories, don't get me wrong. And I do know for some people they might feel. So for example, when I coach or mentor people, I always say if a job gets put out, do go and speak to the person putting the job out. And then people go, but I don't want to do that because I don't want them to know I'm black, and I just sort of go like, I've never honestly, like, the roles that I've gone for, I've always spoken to the person that's put it out,
Do you
and
think
most of the
accent is part? Because you
what's
speak.
that?
Do you
Oh,
think accent is part? Because you speak like you're British.
oh, that's another story, Nanelle. This
Yes, because
accent.
it's so clear that you are like British. You understand, but
Yeah.
for others that have a thick African or, let's say, Nigerian accent or Ghanaian accent.
It's interesting you say that, because I think the reason why I speak the way I speak is, when I reflect now, was because of racism. Because I remember before applying for nurse training, I'd applied for some other roles before, and I vividly remember going for an interview. Coming from the Caribbean, you speak English, don't you? So and I remember the person saying, and this is, not verbatim, but this is the memory I have, that I sounded like I just came off the boat. So what that said to me, was that actually to be able to fit in, I needed to
They speak like
change. So hence I end up with, and it's really weird because when I speak to my sister, my mom, and people from home, I go back into my Vincy twang, and
them.
you
Please,
know.
please.
It is one of those things that I
Yeah.
so and
I
then
love the accents, by the way. It's really nice. And I live in Northern Ireland, and that's
yeah.
not kind of English that they speak. They don't have this accent you have, and this
Yeah.
is the accents that I was looking forward to when I was coming to the UK. But that's not what I'm having here. I really like it. It's nice. So, how long have you been in Band 9?
I was acting in it for about 18 months, so from June 2020 to November 2021, when I eventually got it substantively. So it'll be almost 2 years now. Yeah.
What is your job title now? What exactly?
So yeah. So my job title is I'm the Lambert Living Well Network Alliance Director. And essentially what that means in Lambeth, we've got an alliance that's made up of 5 partners, of which South London Ward to the NHS Trust is one. We've got the local council, or social care as people may know it, the Clinical Commissioning Group, or CCG, which is now South East London CCG, but mostly the Lambert bit because they've joined with another 5 CCGs. And then we also work with 2 voluntary care sector services, Certitude and Thames Reach. So essentially my role is that I am the strategic director for the alliance. So I set the working with partners, of course, set the direction of travel based on what government policy is, law, Department of Health,
Wow.
NHS England guidance, which changes
Wow.
from time to time. Yeah.
Wow. Wow. So you don't necessarily go to the ward these days. It's more about
So I don't do the hands-on or bedside nursing, but I visit wards, one, to meet staff, and hear from them what their struggles are. It's good to be in touch with the front line, because sometimes I hear it a lot, that we could be very far removed, and I'm quite a hands-on nurse, which is quite difficult. So even in this role, I've got a team that I would still do assessments for them. I ring people up and I do a telephone assessment. I write up the letters. I cover part of my role is I need to cover the director on call. So if there's any problems within the system, I get the call in terms of beds and stuff. And it might mean I might need to go in if there was a major emergency. I haven't yet. But, that's a possibility. Because we've been working in COVID, it's been, quite a lot of home working. So I haven't been out and about as much as I would like to, but part of it is I go to team meetings in the morning as well. We call it zoning, just to understand where people's risks are, and I will put my 2 cents in, etc. So yes, it's not as hands-on as I would like, but I'd like to think I'm a bit, because I do the work that I do in terms of the work with our front door service. I still speak to patients.
What's the color of your uniform? What uniform do you wear? Do you even have a uniform?
We don't wear, so in mental health, we don't wear uniforms, and part of that is because you use yourself a lot in terms of how you work with a patient, and it was felt, and I know there's some thoughts of this might change. So it was felt if we're in a uniform, it sort of has a them and us. When we take people out in the community, you want them to feel part of the community and not feel othered.
So for
You
your
obviously have to.
you did mental health.
I did mental health.
And then your degree was also like a mental
Also mental health. So it's mental health practice. I've also got a master's in public health. And the reason I chose public health is I wanted to do something a bit broader than mental health. But I think it's got really good synergies, because when we think public health, we're thinking about the reasons why people might have a mental health problems, and you think about the different deprivations that people have. So, yeah.
Okay. So I read from your YouTube about section that you want to help, is it 100 people in the next?
Yeah.
Briefly tell us about it.
So I started my YouTube channel, I think, at the start of the pandemic. And I've also got a blog that I think I've done 2 entries. And the reason behind it was...
I'll leave them.
Will do. And the reason behind it is I recognise I'm in a very privileged position, being in the banding that I am. There's not a lot of people that look like me. And I do mentor people, and people ask me for advice, but I was just thinking, why can't this advice just be available for everybody that wants to, get to where they want to in their career? Hence the YouTube channel idea. And on there, I thought I'll do a bit of, talk about how you can do your nurse career. I've got locks. I do my own hair unless I go to my sister's. So I thought I'd do a bit of that. And then I do love to travel as well, but on a budget. I haven't been able to do the last 2 bits because I guess my motto is I want to leave nursing and I don't want to call it a ladder. I've developed this new thing. I want to create an elevator for people, because I had to climb the ladder and people before me had to build the ladder for us to get to where we're going to. I want to make it a lot more easier for people that look like us to get to where they've got to, or just stay where they are and be fulfilled in their roles. But yeah.
So you mentioned budget. How much do you earn as a band 9, if you don't mind?
So, no, that's fine. So at the moment, my basic pay is £93,735, and because I work in inner London, I get inner London waiting of £7,092 on top of that. So. And I did the math because I thought people want to know. We don't talk about money enough, but we need to. So before tax, that is £8,437.20. But my take home, because I pay a pension as well, is on average £4,934.51. That's what I earn this month. Sometimes it goes over when they add in my on-call shifts.
Wow.
So
90,000 is like 3 times what I earn. Wow. Yeah. Wow. Like, it's well deserved with all that you're doing and all that. Wow. Are you able to do overtime?
Like before, I used to do like bank and agency. Like now, I don't. The only sort of overtime that is when you do director on call and you get paid an extra for that. It's not that much, but yeah. And at the start of the pandemic, I did do, because we had like people on site to support staff. So I did do like some weekend on sites, and then they paid us at, I think, the equivalent of a top band 7 or something. So that was, quite good.
I know that several people watching us that really would want to get to where you are? And I know you have a video on your channel where you share tips on how so people can progress. Guys, go and then watch. But on this channel, what do you have to tell the people that want to be like you, like me?
And I was thinking of, this, and I thought one of the things I always say to people is set a clear goal and objective for yourself of where you want to go to. So what area of nursing are you really passionate about? So before I thought I'd be a director of nursing, but I've obviously changed and I'm a service director. But always knew I wanted to get to this role. So I think always have at least 5-year plan, and I've got another 5-year plan as well. And then what that helps you to think about is what experiences would you need to get, which then dictates what roles you should go for. So what I don't want people to doing is going for a role just because it's a higher banding, that it doesn't align to what you're passionate about, is not going to get you to your next place. The other thing I always ask people as well is, don't think of jobs as one job. One of my mentors always used to say, so what's the next step after this role and the next step after? So it's thinking a bit short term, medium and long term, because again, so I'll say it here, I see myself being the CEO of a NHS trust, so I know to get to that level, I need to do at some point.
I was about to ask you your operations next.
So I know I'd need to get to do a chief operating officer role. I've already done what you call a quality role in like a head of nursing role, and I might need to do another service director role. So I'm already thinking about what I need to do to get to that. Does that make sense?
Make me proud, I can't wait for when you become the CEO and they'll have another
comeback. Yes.
Maybe I'll be in your office then, not through life, and they'll have a conversation. Oh God. I am so impressed. Like what you've achieved is so admirable. Do you have daughters?
I don't have kids yet, but I do have my adorable nephew. If you look at my Instagram, there's a picture of me. So they've put all these pictures outside the hospital. And there's a picture of me and my nephew looking on in awe. No kids yet, but so the other things that I think people must absolutely get is a mentor. And when I say get a mentor, is choose somebody that you look up to, that has either got to where you want to.
I have a couple.
Of course you can.
Okay.
Coaching as well, because in one of my videos I talked about how I used coaching to help with my interview prep as well. But also the reason why I say coaching is that it pushes you to think and work differently, so it pushes you out of your comfort zone. And more importantly, sponsorship and networks, because what I realize as you move higher up the bandings, a lot of there's a bit of what in your performance of always, do work to the best of your ability, get yourself stretch targets or, champion something, lead roles, because what that helps to do is give you exposure to different people. But also when you think people aren't looking, they're looking. So they'll be saying, oh, that girl Nanelle, she's been doing this in the ward. You don't even know this is coming up soon. We need to think about how we support her into this. So that's called PI. So performance, the image that you have, and the exposure. And we don't do this enough, but shout about the things that you have done, because if you're not shouting about it, nobody else is going to. What I mean? So you have to have the results. So when you go to the interview, you could say, well, I've got good communication skills, but you might think, but I'm only a band 5 nurse. Well, you might have dealt with a difficult patient, you might have dealt with a difficult issue that you led. We're all leaders wherever we are, and it's just thinking about those examples. So those were the key things. And obviously, I think as immigrants, we always have the educational knowledge to back things up. Don't stop doing that, but don't only do that.
Wow. Wow, well said. What are the challenges of your role? The main challenge.
So and again, I wrote this down because
It's fine.
If I think about my current role, so our key challenge is workforce, and that I think is across the piece. And part of it is we don't have enough nurses out there, so we need to think differently about how we support colleagues. But it's not even that. It's about how, for me, how we retain staff and role model the behaviours that we want to see and support people to be compassionate leaders. Because like policies, they're always there, but we need to be human when we interact with our staff and keep them. Finance is always a challenge because as we're being expected to do more for less and be more creative around that, and we've got finite resources. In my role, I'm a protector of the public purse, so I need to think about how I spend that resourcing quite specifically. And there's always change. So as I mentioned, throughout my career, there's constant change. So the NHS is going through a number of changes, moving into what we call integrated care systems. We're still in the middle of a pandemic, so we've had to work differently, and potentially bringing people back into work soon when we still got high infection rate. But the other thing that we did touch on is where work I've got population that's from a big BAME background, and I work in mental health, and we do have overrepresentation of Black people and Black men in mental health. So it's thinking how I work with colleagues to develop culturally competent services so that we can work with people where they're coming from and ensure that we change the balance. And that goes for staff as well. You know, we're talking about career progression as well. We need to ensure that within every level of the NHS and not just at the lower bandings, there is representation of the people that we look after. So those are some of the challenges.
So your final words.
Right. I want to say, and I always say this on my channel, just be bold and brave. Ask for help. There's lots of us out here who are willing to help and guide you. So, you know, yeah, ask for help and be bold and brave in your career dreams. Dream big. We always say aim for the sky and you fall amongst the stars where you belong.
You know, the lady that told me about you on Instagram, like she was just really hyping you, and then she was like just saying good stuff about you. She said, "No, you have to interview her," and I'm so glad I did. I'm so glad I saw her message. Thank you so much, guys. Head over to Sap's channel. She has so much good stuff to share. And if you enjoyed this video, kindly give us a thumbs up and then tell us what you think in the comment section. I'm really, really grateful. Thank you.
Thank you, Nanelle.